My name is Dan Robertson. I'm an orthopedic surgeon here at Hill Country Memorial Hospital in Fredericksburg. I specialize in sports medicine, but I also do a lot of joint reconstruction, particularly of the knee and hip and shoulder. I did a fellowship in San Diego, California in sports medicine. I spent a year out there working just with some physicians that specialized in that. He ended up asking me to stay on in San Diego, so I ended up living out there with my family for about 12 years. And at that time I got involved with the San Diego Chargers. I was their team physician for many years. Also the U.S. Olympic teams, particularly the volleyball team, and also multiple high schools and colleges in the area. With regard to shoulder problems, they're very, very common, particularly things like rotator cuff tendonitis or bursitis. We often see a lot of people that have a torn rotator cuff or damage to what's called the labrum, which is like the meniscus or cartilage in the shoulder. These things are often very painful and bothersome, most aggravating with activities, but also painful at night. The majority of them heal with conservative treatment, including over-the-counter anti-inflammatory medicine, cortisone injections, physical therapy, ice, and rest. In the knee, there's multiple problems in the knee that I see. When I first see a patient with a knee problem, I think it's very, very important for me to take a thorough history about how the problem started and any injuries or trauma that may have occurred that led to the problem developing, because that can often dictate which direction we may go. In addition to a history, I do a very thorough physical examination, and also x-rays are taken here in the office so I can evaluate the status of the knee or whatever joint we're talking about in that particular case, and then determine what the best treatment approach may be. It may be something simple like ice packs and anti-inflammatory medication. Sometimes physical therapy is necessary, or injections such as cortisone or hyaluronic acid, but there's many, many options to treatment. If one's knee does not respond to conservative treatment, and I'm talking at this point about arthritic conditions of the knee, and x-rays reveal a severe arthritic condition, then often we have to consider joint replacement once those non-operative techniques are not successful any longer. That's something that I do an awful lot of. We do it at what's called our Restore Joint Center here in Fredericksburg. It's a concept that I brought to Hill Country Hospital in 2011. It's designed after a superior performance program that I studied. It's based on best practices worldwide, the most recent high-level technology, and a comprehensive team approach where we treat patients from the time they make a decision that they need surgery to the time they go home with home care and home therapy. I think the care of patients is best done when a patient and a physician work together. I think it's very much a team atmosphere that I try to promote here in my office, where I try to treat every patient as an individual. No two patients are just alike. They respond differently to every treatment program that we use. Some respond very well to one thing and another may not, but there's a lot of things to try, and so we like to try everything conservative before we get to the point where we talk about surgical treatment. I'm a Texan originally. I grew up in Austin and went to UT, went to medical school at UT Houston, and then went on to do my fellowship in San Diego. I'd always been interested in sports medicine. I'd injured my knee in high school and college athletics and had multiple surgeries on my knees, so it was always something that I felt like I needed to go into.